I'll recognize Mr. Kennedy for 3 minutes.
Thank you, Mr. Chairman. To Chairman Upton and Pitts, as well as Ranking Members Pallone and Green, I want to thank you for prioritizing mental health reform on this committee. Congressman Murphy, I'm grateful for your leadership on this issue and in your diligence in crafting H.R. 2646. Having dedicated your career to mental health care and treatment, the bill you offer today gives us a solid foundation to start with as we work to address the issue in our committee and in Congress. I also want to recognize it appears to be a number of advocates and family members in the room. Thank you for being here and thank you for your advocacy. According to the American Psychiatric Association, over a third of adults and over 1/5 of children suffer from mental illness. But over half of kids battling severe mental health problems receive absolutely no care or treatment at all. In fact, 55% of counties in this country do not have a single practicing psychiatrist, psychologist, or social worker. Our mental health system has a crippling access problem. People who need help aren't getting it. And that is costing our families, our communities, and our loved ones dearly. We can't afford not to get this right. H.R. 2646 addresses some of the key gaps in our system. In particular, I applaud the provision that would eliminate lifetime limits on coverage of inpatient psychiatric hospital services under Medicare, and the provision that would allow same-day billing in Medicaid. I also agree that we have to prioritize the strengthening of our mental health workforce. However, I think there are significant improvements that need to be made to ensure that this bill tackles the breadth and depth of the reform our current system needs. First and foremost, the bill fails to clearly address the lack of resources plaguing our country's continuum of care. The reason our mental health system is inadequate today isn't just because of programmatic shortcomings, it's because it has been woefully underfunded for years. I hear the same refrain every single day in conversations with patients and advocates and doctors throughout my district. We don't have enough beds. We don't have enough doctors. We don't have enough wraparound services. We don't have the tools we need to help people. From provider reimbursements to basic funding for community health facilities to support for substance abuse programs, any legislation that we pass in Congress must provide the resources required to actually implement the proposed reforms and strengthen the full spectrum of care. If we ignore that piece, this legislation will not be more than a half step. A report released by Tufts Healthcare Institute a few years ago looked at solely the opioid abuse epidemic in particular and estimated that the total societal cost of opioid abuse was $55.7 billion. Healthcare costs specifically were $25 billion. A 2012 report from HRSA said that there were 3,669 mental health professional shortage areas across this country containing almost 91 million people. These are powerful, significant numbers, ones that we must discuss and address. I also share the concerns of some of my colleagues that the bill in its current form threatens civil rights and privacy of mental health patients, particularly on Section 2606 that deals with AOT. Coupled with larger funding concerns, this provision makes it easier to involuntarily commit mentally ill into a system unequipped to provide them with the treatment that they need. In Massachusetts in particular, one of 5 states without AOT laws on the books, the bill could have a particularly hurtful impact, denying critical funding support at a moment when our communities are wrestling with an opioid and addiction epidemic that has already cost over 600 lives this year. The discussion we are going to have today is critical and overdue. I applaud the shared commitment on both sides of the aisle and Congressman Murphy for his ability to dig into the details of this legislation and ensure that we get it right. Thank you, and I appreciate the extra time.